بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is a new case of OSCE and this is case number 2. Here we have chest X-ray of the infant. What is the clinical representation of this infant? Take few seconds and think what are the clinical representation of this infant. This infant is presented with respiratory distress. Okay, what is your diagnosis? As we see here in this chest X-ray, we have two findings. We have left-sided pneumothorax, as we see here in the left side, and some collapse of the left lung, and some of the pneumothorax also under the surface of the left lung. And we have a pneumomediastinum, and we have the thymus here is elevated upward. And we have probably this is an artifact, and this is a skin fold rather than a pneumothorax. So this patient has left-sided pneumothorax and pneumomediastinum. What are the radiological signs of the pneumothorax and pneumomediastinum in this patient? We have two signs here for pneumomediastinum, and we have also two signs for pneumothorax. Please try to pick up the name of the signs. Here, as we see here, as I said before, we have sharp line, white line, and no lung marking is seen peripheral to this line. And this is the first sign. And if we compare this costophrenic angle with this costophrenic angle, and this is what we call deep sulcus sign. And this is another sign of pneumothorax. If the patient has tension in pneumothorax, we have shifting of the mediastinum, but in this patient, we don't have tension in pneumothorax. What are the signs of the pneumomediastinum in this patient? As I said, there is elevation of the thymus, and the elevation of the thymus, it is giving the sign of angle wing sign, wing sign, or spinnaker sign. This is the spinnaker sign, and this is the elevation of the thymus by the pneumomediastinum. And also, as we see here, this is the left side of the diaphragm, and this is the continuous the diaphragm. We see it under the heart, and we have the right side of the diaphragm. So this is another sign for pneumomediastinum, and we call it continuous diaphragm sign. So we have two signs for pneumothorax in this patient and two signs for pneumomediastinum for this patient. In pneumothorax, we have sharp white line with no lung marking peripheral to that line, and we have deep sulcus sign. This is for pneumothorax, and for pneumomediastinum, we have angle wing sign or sphenical sign, and we have continuous diaphragm sign. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أستغفرك وأتوب إليك.